Good evening. I'm Harry Keeling, and on behalf of Alaska Public Media and the Alaskan Aviation Safety Foundation, welcome to Hangar Flight. This evening, our guest is well known to many of you, Dr. Petra Illig. She's a senior aviation medical examiner. I've known Dr. Illig and been a friend of hers for many, many years, and she's been on this program, and it's a pleasure to have her back. She's a graduate of University of Washington Med School, broad and impressive career, was emergency room doc, and worked with Delta Airlines in their corporate flight medicine department. Dr. Illig moved to Alaska in 2001 and opened her own flight medicine practice. Petra, it's a real pleasure to welcome you back.
Thank you.
Thank you for agreeing to be on the next couple of shows.
Okay.
I think we've come up with a couple of topics that'll be of great interest to our audience. And one of them, in fact, the one I'd like to start with is this whole business of sleep apnea. Mm-hmm. What is it, and why is the FAA interested in it?
Well, the sleep apnea, the part that the FAA is most interested in is obstructive sleep apnea. There's also another form that's less common called central sleep apnea, which has to do with problems in the brain, not allowing people to sleep normally. But obstructive sleep apnea is a mechanical obstruction of the upper airway that can happen under certain circumstances and certain physical anatomy that produces many episodes of hypoxia throughout the night. It's depending on the anatomy of the throat and the mouth and the upper airway, and to some degree the size of the individual, obesity, short neck stature, that sort of thing. These people are frequent snorers and have some, if not even very many, episodes throughout the night of not breathing as they're working against an obstruction.
You know, it's fascinating because I've heard of sleep apnea, I've read a few things, but I think you were the first one that used the word hypoxia, and I thought, wow, yeah, that's what we're talking about, isn't it?
That's what we're talking about, and because of these episodes of hypoxia, many things happen. I mean, the individual doesn't really go through all the important sleep stages, 4 or 5 of these stages throughout the night, so they don't get sleep. They may be in bed thinking that they're sleeping or not recognizing that they're not sleeping, but frequently they're just continuously interrupted from getting into these large stages of sleep where whatever happens, it happens to clean our brains out. And then also these multiple episodes of hypoxia are really bad for the brain as an organ, for the heart especially. People with untreated serious sleep apnea have a much higher risk of heart attack and stroke and electrical problems with their heart, for an example. In addition to the cognitive issues, you know, if you're constantly sleepy and even you don't recognize it, it is sort of like being mildly impaired by alcohol, that kind of cognitive dysfunction.
So I guess that's, for me, the oversimplification is it's not really the sleep apnea that's a problem, it's the after effects and the impact on the next day
and the health, yes, on the cognitive functioning the next day, which is a safety issue, of course, and then, of course, the health of the individual because of the other associated medical conditions with untreated sleep apnea.
So what I think just recently the FAA came out with what's the new requirement?
In March, the airman applicant is obliged to answer a few questions about sleep apnea that has to do with whether or not they have ever been diagnosed with it, have been treatment suggested for it. And then the AME is supposed to also ask some questions about whether or not they're heavy snorers, whether they have daytime drowsiness that may be part of not getting enough sleep at night. Of course, in the aviation world, we know most of that is from scheduling and not necessarily from sleep apnea. And we're supposed to also consider other risk factors that are spelled out by the American Society of Sleep Medicine, like asking them, are they heavy snorers? Do people complain about them snoring? And also consider their body mass index. None of these are, except if a pilot says, yes, I've been treated and I've just never told the FAA or I forgot or something like that. Many of these are issues where the pilot then goes back to their own doctor and confers with their doctor as to, excuse me, whether or not they should be further screened. But in reality, everybody who is otherwise qualified for their class medical on their exam still walks out with a certificate, but they may or may not need to have follow-up information from their physician.
I want to pick that up in our next
Yes.
session.
Okay.
So very interesting. We want to talk a little bit about treatment and some of the other thoughts that you shared with me. Ladies and gentlemen, I hope you enjoyed tonight's program with Dr. Illig, and I think you'll want to tune in next time to wrap this topic up, and then we're going to also talk a little bit about the most recent tragedy with the German Wings aircraft. Until next time, fly safe.